Well, hello, everybody. My name is Dr. Mario San Bartolome. They just know me as Dr. Mario here at KCS. And I'm a family physician and also an addiction medicine specialist. And I have the pleasure to provide services at KCS, one of the premier community clinics in Orange County. And what I'm here to talk to you today is about Alcohol Awareness Month. And that's the month of April. And this is near and dear to my heart because, of course, I mentioned that I'm a specialist in addictions, and certainly alcohol is one of the oldest and one of the most impactful types of substances that can sometimes involve addictions. So, one of the most important things you can do is to arm yourself with good information. Though alcohol is legal and it is fairly socially accepted, almost every culture has some version of a type of alcohol that is used in celebrations. It's used in ceremonies of different kinds. It's prolific. And with that has come other consequences. And we are in an interesting time around substance use in general. But alcohol still is a very significant contributor to morbidity and mortality. That means, hurting people and killing people. And it's worldwide. In the United States, we actually have nearly about 100,000 deaths per year related to alcohol use. And I want you to compare that to what's scary and in the news about drugs like fentanyl and methamphetamines, and we make a big deal about that. And that was somewhere around 112,000. So not too much different, only that number with drugs is all drugs combined. The number around alcohol use, that's almost the same, of about 100,000 deaths, is just alcohol. So it's actually a really big deal, even though it is legal, and even though you don't get arrested and go to jail, or you don't see it on the news quite as much. But this is why we have April being Alcohol Awareness Month. We do need to have a time when we sit and reflect a little bit about that. Of those 100,000 deaths, about a half of them are from chronic misuse related issues. So people that are constantly drinking, so not 100% of it. And so there are consequences to not drinking, consistently, or being in that group, where up to about 25% of folks will die of a related suicide. And so that's where we attribute some of the consequences of alcohol use. So alcohol use complications we've been seeing it continue to escalate and increase over the last decade. Some of the most concerning patterns that we see now is that there's a faster rate of rise in problems that occur in women. COVID-19 issues didn't make it any better. And by problems, I mean the kind of things that will land you in the hospital, the kind of things that impact your life. When it comes to alcohol, we typically see these things in the 4th through the 6th decade of life. Not so often when people are young. Certainly there can be issues around binge drinking and accidents. Those would be the kind that young folks would be most susceptible to. And then as we get older, 40s, 50s, 60s, they become issues that are a consequence of chronic use and its impact on our bodies. And so you might be thinking, well, what's the difference between things like problem drinking or actually having an alcohol use disorder, right? I think that's a fair question. When is it a problem? And we consider heavy drinking to be when somebody, in this case a male, consumes 4 or more drinks per day, and in female, 3 or more drinks per day. So when we do all the studies and we start comparing the number of drinks to when problems start happening in people's bodies and minds, then we start seeing it right around there, around 4 drinks or more per day in men and 3 in women. A little bit of a way that you can begin to view it. And if you're wondering what a drink is, because I said, 4 drinks. Well, what is a drink? And a drink, we normalize it across different types of drinks. So if we're talking about a distilled spirit, which is, things like vodka, scotch, whiskey, what some people call hard liquor, that would be 1.5 ounces. That would be equivalent to a shot. And then if it's wine, it's about 5 ounces, which would be about what we normally pour in a glass of wine. And then we would compare that to beer, and that would be about 12 ounces of an average beer. There's some variations in types of beers, but an average beer, that would be about 12 ounces. So all of those constitute one drink. And so you can substitute that to kind of see, what's a problem in terms of drinking. Some of the common effects of alcohol use are ones that you might already be familiar with, as liver impairment. So it can damage your liver. It can really wreck your liver so that it doesn't work anymore eventually. But along the way, it causes other problems. It can also impact your thinking and decision making. And this we see with people having consequences like driving under the influence, legal problems, relationship problems. Those aren't even problems that necessarily happen to your body. They just happen to you in the scope of your happiness, your self-actualization in life. You can also get so dependent on alcohol that it can cause withdrawal symptoms, things like shakes. And in the extreme, it can be a seizure and death. So getting dependent on alcohol can be a very big deal, and for some people can even be life-threatening. Other things that are associated with alcohol use effects that maybe you might not totally associate with it is pancreatitis, is an inflammation of the pancreas. You can have bleeding disorders where you begin to bleed out for longer periods of time. And then also there can be some significant effects to your nervous system, as well as nutrition, and it almost spares no organ when it comes to alcohol. So it's definitely a big deal, and we do see a lot of people with gastrointestinal bleeding, and sometimes you can die of complications to that versus the alcohol itself. So how do you know if you have some sort of an alcohol use problem, right? And I'd say, number one, if you're asking yourself the question right off the bat, that's already a sign that maybe that you should get it checked out. You should ask people that you trust, from the standpoint of those people that are your providers of health and medicine. So one of the things you can also ask yourself, we have this little thing called a CAGE, C-A-G-E, and that stands for, have you ever felt that you should cut down on drinking? Cut down, that's the C. Have people annoyed you by criticizing your drinking? That's the A, annoyed. Have you ever felt bad or guilty about your drinking? The G. Have you ever had a drink first thing in the morning, what we call the eye opener? That's the E. And that's kind of a very crude way to begin to screen, to say, you know what, maybe I should get this checked out. And it's quite a wide range of different possibilities. Most people that consume alcohol do not become dependent on alcohol. So if somebody has a problem with drinking alcohol, or you might feel that you do, what can you do? I would say, number one, go talk to your medical provider about your concerns. Ask them to kind of evaluate whether or not you might have a problem with alcohol. Sometimes that can be from your labs. Sometimes it can be from even looking at you, or from taking a history, from asking you a bunch of questions and seeing, how does alcohol impact your life? Does it take away from the quality of your life? Has it been difficult to stop using? Do you spend an enormous amount of time using alcohol or recovering from alcohol? Does it impact the big, important dimensions of your life? Your role as a parent, your role as a professional, maybe in your job, or of being a conscientious and loving partner in a relationship. These are the things that get destroyed in alcohol use disorders, and those begin to give you hints that there might be an issue. If the alcohol problem seems more serious, then it's going to be important to step it up. But with that said, just inquiring about it, if there's kind of a sign of some problem drinking doesn't reach the level of alcohol use disorder, there's a lot that can be done with some simple behavioral changes. And sometimes even with talking to people that have experienced alcohol use disorder and can relate to some aspects, even if it's very early on in the process. And it's important to be open to discuss those kind of things that can be life-changing, and it can also help you avoid some of those problems that contribute to that 100,000 deaths per year. So we mentioned For the more serious situations, then you really do need to get evaluated by somebody that knows a little bit more of what they're doing, specifically around alcohol use. And they might check your labs. They're going to for sure ask you a detailed history. They're going to also look at treating any underlying issues like mental health issues that oftentimes go together: depression, anxiety, even other more serious conditions like bipolar disorder. They can often go together with some of these things, and it needs to be treated. It cannot be ignored and can be a contributing factor, but it's not the same thing. They're not the same thing. They can kind of go in parallel, but they have their own trajectory. And then also any sort of physical health issues that may be underlying. Like your medical provider can help you in addressing some of those things. When the circumstances are very serious, then really you need to go to you need to get a referral to a provider, or if there's a provider in that particular health system that is a specialist in addiction medicine, which would be the best, or a psychiatrist, then even better, because then you can get placed in the right type of treatment, and the success rate of people that actually go to get treatment in terms of improving the quality of their life and safety is actually comparable to other chronic illnesses. Now, KCS actually offers a lot of this. We offer addiction medicine evaluations, including for alcohol use. We offer medications that are FDA approved to treat alcohol use disorder and others. We also provide some of the structured support and mental health that is important to be able to give somebody when they're going through the process at whatever stage in addressing their alcohol use issue. So really, it's a very unique and comprehensive place as a community clinic to get all that, including some group counseling, and that augments what you can get outside of the clinic, which are things like Alcoholics Anonymous, or what we call mutual support, where one person provides support for the other. So although alcohol is a common substance in society, again, arm yourself with the facts and always be open to asking for help should you think that you have an issue, or point somebody in the right direction if you think they might have an issue, because it is very important. And I hope that April is as far as Alcohol Awareness Month, is one where you give it a little bit of thought and how alcohol might impact your overall wellness. And we thank you very much for your support at KCS, and as a patient, as a area of support, we certainly appreciate it.